Hello, everyone. Welcome to the FY26 CARA Informational webinar hosted by ONDCP and CDC. My name is Ivy Francis, and I'm a contractor with CDC. Before we begin, we want to review a few housekeeping rules for all attendees. All attendees will have their cameras off and microphones muted for the entirety of the session. We ask that you put all questions for the speakers in the chat, where we will respond as we're able to during the session. The webinar is being recorded and will be made available at a later time. We will share more information about the recording at the end. Finally, if you encounter any technical issues during the session, please use the chat to communicate your issue, and we will have someone assist in troubleshooting. Thank you so much for your time. We will now turn it over to our colleagues Helen Hernandez and Abner Garcia Lopez at ONDCP to begin.
Hello, everyone, and welcome to our Comprehensive Addiction and Recovery Act Local Drug Crisis Grant Program Applicant Workshop. My name is Helen Hernandez, and I'm a Senior Policy Analyst here at the White House Office of National Drug Control Policy, and I'm joined by Abner Garcia Lopez, Policy Analyst for the DFC and CARA program, and together with our colleagues at the CDC, we'll be walking you through the NOFO, the Notice of Funding Opportunity Announcement for the CARA grant program. We are focusing on opportunity number CDC RFA CE 260110. Substance use among youth remains a serious public health concern, particularly the misuse of opioids, methamphetamine, and prescription drugs. And so despite recent declines, overall youth use of these drugs, and it remains an emerging drug threat, such as those synthetic opioids and fentanyl. And so we have intensified the urgency to implement evidence-based prevention interventions to address these efforts. And so I want to start by thanking so many of you for joining us and your commitment to protecting your communities. So where can you find the CARA Notice of Funding Opportunity, also known as the NOFO? You can find it posted on grants.gov. We have the web link here, but if you enter the funding opportunity number that I shared with you all on that initial screen, on that initial slide, I should say, the Notice of Funding Opportunity will pop up for you. Of note, the applications must be submitted via grants.gov, and they have to be submitted by June 8th, 2026 at 11:59 p.m. Eastern Standard Time. Please note that no late applications will be accepted. So the CARA Local Drug Crisis Program was established through the Comprehensive Addiction and Recovery Act, also known as CARA. The program was created in recognition of the growing impact that opioids, methamphetamine, and prescription drugs were having in communities across the country, particularly amongst our youth. And it focuses on building upon the subject matter expertise of our current or former drug-free communities grant recipients to implement some local change. Therefore, the theory of the CARA program probably sounds very familiar to what you're used to. We provide a small amount of federal funding, and combined with a local match of resources and volunteer support, are able to expand and amplify our prevention efforts. And it's by mobilizing community leaders, such as those 12 sectors that you're used to within your drug-free communities program model, you're able to change the local community's environmental conditions that are tied to substance use. We're trying to change the environment in which drug use happens. Under the CARA program, they are more specific as far as the substances that we're focusing on. And again, the focus is on environmental change and ultimately contributing to these reductions in your communities among our youth and over time among our adults. So the Comprehensive Addiction and Recovery Act, as I mentioned, was created by the CARA. The CARA program, it has quite the long name. It's the Comprehensive Addiction and Recovery Act Community-Based Coalition Enhancement Grants, which is quite the mouthful, which is why we keep it to CARA. was established as an enhancement to the DFC program. And the purpose is specific to addressing the local drug crisis and emerging drug use issues in your community. And so I'm going to pass it on to Abner to cover the program's goals and to walk us through some key information related to compliance with executive orders before we pass it on to our CDC colleagues to cover the specifics of the NOVO.
Thank you, Helen, and good afternoon, everyone. It is an absolute pleasure meeting you all virtually, and thank you for allowing us the opportunity to guide you through this process, right? So let's just continue now with the presentation. So the CARA program is guided by two primary goals, right? The first goal is to prevent or reduce the use of opioids, methamphetamine, and prescription drugs among youth. And this is critically important because adolescence is a key developmental period. Early substance use can have a long-term impact on the brain development, the decision-making, and overall health outcomes of our young population. The second goal is equally important, which is changing the culture and context around the acceptability of youth substance use and misuse. This means addressing the environmental and social factors that influence that behavior, including community norms, perceptions of harm, availability of substances, access to prevention messaging, and the broader conditions in which young people live, learn, work, and play. Effective prevention is not only about educating individuals, it is also about creating healthier environments that support positive decision-making and reduce risk factors. This is why coalition-based approaches are so valuable. They allow communities to implement comprehensive strategies that engage multiple sectors and create sustainable change over time. Next slide, please. So this slide that you see in front of you provides a high-level information with respect to eligibility requirements, right? And some of the key grant details for the FY26 CARA program. So let's start off with eligibility. Applicants must be community-based coalitions that are actively addressing opioid, methamphetamine, and or prescription drug misuse among youth at the local level. And applicants must also be located within the United States or U.S. territories. On the right side of the slide, you will see several additional grant details. So for the FY26, approximately 50 community coalitions are expected to receive funding, and the program will provide approximately $3.75 million in funding that will go directly to these communities across the country. And that means that the individual awards are expected to be approximately $75,000 per year. And lastly, the grants are structured as a 5-year period of performance with 12-month budget periods. Next slide, please. Now, with that said, as applicants prepare their submissions, it is important to carefully review all administrative and national policy requirements that are outlined in the Notice of Funding Opportunity. This slide that you see in front of you highlights several executive orders and federal policy considerations that may apply to applicants and recipients during the period of performance. It is important to note that this list is not exhaustive, and additional requirements may apply throughout the life of the award. Applicants are responsible for ensuring compliance with all applicable federal statutes, regulations, and executive orders associated with this grant. And for that reason, we strongly encourage all of you to review the NOFO carefully and coordinate internally with your organization leaderships to ensure full compliance. Being proactive early in this process can help avoid delays later in the application process, and also It ensures that your applications are responsive, are complete, and compliant with all the federal requirements and statutes. Next slide, please. Now, before submitting an application, there are several important administrative steps that you all should be completing as early as possible. First, applicants must have an active registration in SAM.gov. This registration is required in order to apply for and receive federal funding. If your organization's SAM's registration has expired or is nearing expiration, we strongly encourage you to begin that renewal process immediately, as it can sometimes take longer than expected. Applicants must also maintain an active grants.gov account. The application package and all required forms can be accessed directly through this website using the opportunity number listed on this slide, and the opportunity number that is also included in the very first slide of the presentation. In addition, we encourage applicants to thoroughly review the NOFO and all supporting materials before beginning the application process. Taking the time to understand the eligibility requirements, application components, and submission instructions can help strengthen the quality of your application. And finally, if questions arise during this entire process, applicants may contact the CARA NOFO helpline using the email address provided on this slide. The team is available to assist with any questions related to this funding opportunity. And our goal is to support you all throughout this entire process and to help ensure communities are well positioned to submit strong and competitive applications. So with that said, now I am going to turn it over to Karen Vetch over at CDC to guide us through the NOFO.
Good afternoon, everyone. My name is Karen Vetch, and I am the branch chief for the DFC and CARA programs at CDC. We will now begin part 2 of today's webinar. This section focuses on the statutory eligibility requirements and submission instructions for the FY26 Comprehensive Addiction and Recovery Act, or CARA, Local Drug Crises Grant. Applicants must meet every statutory requirement to be eligible for funding, and failure to meet even one requirement will result in an application being deemed ineligible and not moving forward to merit review. To be eligible, a coalition must be able to receive federal funding. This may be done directly or through a legal entity eligible to receive federal funds, such as a fiscal agent. Be a current or former recipient of DFC funding. Demonstrate that the local rate of opioid or methamphetamine misuse is significantly higher than the national average, or that rates have remained higher than the national average over a sustained period of time, and be able to report on required CARA core measure data. Applicants must provide documentation demonstrating that all statutory eligibility requirements have been met. This documentation serves as formal proof of eligibility. Required items include proof that the entity is eligible to receive federal funds, disclosure of any current or former DFC funding, a statement describing local rates of opioid and methamphetamine misuse, and a description of how the applicant will meet CARA program evaluation requirements. Let's go through each of these requirements individually. The first statutory eligibility requirement is the ability to receive federal funds. There are 2 ways this requirement can be met. First, the coalition itself may be a 501c3 organization on or before the date the application is submitted. Second, if the coalition is not a 501c3 organization, it must partner with a fiscal agent that is legally eligible to receive federal funds. If a fiscal agent is used, applicants must submit a Memorandum of Understanding or an MOU. An MOU is a formal signed document. It outlines the roles and responsibilities of both the coalition and the fiscal agent, and it also describes how the two parties will work together to manage the grant. Another statutory eligibility requirement is prior participation in the DFC program. Both current and former DFC recipients are eligible to apply for CARA funding. Applicants must indicate whether they have received current or former DFC funding by completing the required disclosure checklist and table included in the attachments. Applicants must demonstrate that they have local rates of opioid or methamphetamine use that is higher than the national average. National data sources like Monitoring the Future Survey or the National Survey on Drug Use and Health may be used for the national average. The local data should focus on the target population or community, and data must be recent, reliable, and clearly sourced. Participation in the CARA National Cross-Site Evaluation is also a statutory eligibility requirement. The purpose is to assess the effectiveness of CARA-funded programs nationwide. Coalitions must collect and report data every 2 years, and the required measures include past 30-day misuse of prescription drugs and youth perception of risk or harm associated with use. These data must be collected in at least 3 grades between 6th and 12th grade. If your coalition meets all CARA statutory eligibility requirements, and if all required documentation is included, then congratulations. Your coalition is eligible to apply for CARA funding. We strongly encourage applicants to carefully review these requirements before submitting an application. And I will provide a detailed description of the information you need to provide that proves you meet these eligibility requirements later on in my presentation. We will now move into part 3 of today's webinar. This section focuses on preparing your CARA application. We will review required components, key narratives and attachments, and we will highlight important tips for submission. Before you begin building your application, please confirm that your registrations are active and up to date. This includes a SAM.gov registration and Unique Entity Identifier, or UEI. It also requires an active Grants.gov registration. These processes can take several weeks, so we strongly encourage applicants to begin and verify registrations early. This slide shows the overall structure of the Notice of Funding Opportunity, or NOFO. It is divided into 6 steps. Today's presentation is focused on steps 1, 3, and 5. These steps include getting ready to apply, building your application, and understanding review and selection. We will also discuss how to submit your application and what happens after award. As a reminder, the purpose of this NOFO is to support community coalitions addressing youth use of opioids, methamphetamine, and/or prescription drugs. Funding is available at up to $75,000 per year, and awards may be made for a 5-year period of performance. Applicants must meet all statutory requirements, and again, failure to meet even one requirement will result in ineligibility. Eligible applicants include community coalitions that are 501c3 organizations. Alternatively, coalitions may partner with an eligible fiscal agent. A full list of eligible entity types is included on this slide and in the NOFO. Applicants should ensure their coalition is eligible before submitting an application. Now we will shift to the program description section of the NOFO and what you must cover in your project narrative. The background, purpose, and approach section provides an overview of the program and the strategies and activities, along with the intended outcomes that we expect you to achieve. Your approach should reflect a comprehensive plan that uses the 7 strategies for community-level change with an emphasis on strategies 4 through 7. You will also clearly define the community you serve and include a detailed 12-month action plan that identifies objectives, strategies, activities, who is responsible, and anticipated timeframes. This slide focuses on the data, monitoring, and evaluation components of the program description. Awardees are responsible for participating in the CARA National Cross-Site Evaluation, including collecting and reporting the required core measures. Awardees are also required to submit annual progress reports describing coalition capacity, youth and sector engagement, the community profile, key risk and protective factors, and implementation of youth substance use prevention strategies. Please note that applicants are not required to be in compliance with the CARA National Cross-Site Evaluation requirements at the time of application. We simply want to know how you plan to collect the core measures if awarded. Next, applicants must address organizational capacity in the program description and project narrative. This includes describing your organizational structure, key personnel, community-focused coalition, and partnerships. You should demonstrate that you have the staffing and systems and partnerships in place to manage the award and implement the activities that you propose. For organizational structure, applicants must explain how their organization will support implementation and oversight of the proposed work. You should describe your capacity to oversee program operations, provide fiscal oversight, complete required reporting, and maintain adequate communication. This section should also address how your coalition formulates the goals and objectives and develops and carries out the 12-month action plan, retains and recruits members, and includes substantial volunteer involvement. If you are partnering with a fiscal agent, please note that the fiscal agent must be located in the same state as the coalition. This slide introduces key personnel requirements, starting with the Authorized Organization Representative, or AOR. The AOR is the representative of the applicant organization who has the authority to act on the organization's behalf in matters related to the award and administration of the CARA grant. This role helps demonstrate the organization's capacity to manage both programmatic and fiscal requirements. The AOR must be an employee of the applicant organization and must be listed in the personnel budget category as either federal or non-federal. The next key personnel role is the program director or principal investigator, often referred to as the PDPI. The PDPI provides programmatic oversight of the grant and is accountable to the officials of the recipient organization. The PDPI cannot be the same person as the AOR. And like the AOR, the PDPI must be identified in the personnel budget category as either federal or non-federal. This slide highlights expectations related to your community coalition. Applicants should demonstrate that the coalition is well established, actively engaged, and capable of leading a comprehensive community-wide prevention initiative. Your narrative should show how the coalition partners reflect the needs and strengths of the community or population you intend to serve. The program description also includes funding policies and limitations, and applicants should be familiar with these requirements as they develop their budget and propose their activities. This includes understanding applicable HHS regulations and identifying unallowable costs before submitting your application. If your project is funded, continued funding is contingent upon appropriated funds, satisfactory performance, compliance with award terms, and a determination that the award continues to support program goals and agency priorities. Now let's review the application contents. This is what you will need to submit as part of your complete application package. Your submission includes narratives, required attachments, and other required forms. Key narratives include the project abstract, project narrative, and budget narrative justification. Each narrative should be uploaded in the appropriate form within grants.gov, and attachments are uploaded together using the Other Attachments form. We'll begin with the narratives, which provide the core information reviewers will use to understand your proposed work. In the next slides, we will walk through the purpose, formatting, and key requirements for the project abstract, project narrative, and budget narrative. First is the project abstract, which provides a self-contained summary of your proposed project. It should describe the purpose of the project, what you plan to do, and the outcomes you expect to achieve. Applicants must enter the abstract into the project abstract summary form in grants.gov. The page limit is 1 page, and while this section is required, it is not scored. Next is the project narrative. This slide shows the required headings and subheadings you must use. The narrative must follow the exact headings and subheadings in order listed in the NOFO. These include background and approach, evaluation and performance measurement, and organizational capacity, with the associated subsections shown here. Following the required structure helps ensure reviewers can easily locate and score the information in your application. The project narrative should be succinct and self-explanatory, and it should read like a clear story of your community and your proposed approach. Applicants must upload the narrative using the project narrative attachment form in grants.gov. The page limit is 20 pages, and this section is worth 100 total points. This slide explains how the project narrative is scored. The total maximum score is 100 points distributed across the major sections of the narrative. So the background and approach is worth 50 points. Evaluation and performance measurement is worth 25 points. And organizational capacity is worth 25 points. Each of these areas is further broken down into specific criteria, which we will review in the next few slides. Let's start with the background section, which is worth 5 points. In this section, you will describe the problem you plan to address specific to your population and geographic area. Reviewers will look for a clear description of the local drug crisis and evidence such as sudden increases in youth misuse, increased demand for treatment, and/or lack of resources to address emerging issues. Use recent, reliable data and clearly explain the local circumstances driving the crisis. Next is the approach section, which is worth 20 points. You will describe how you will carry out your proposed strategies and activities to achieve the expected outcomes. Reviewers will evaluate whether your goals align with the CARA logic model and whether your strategies and activities are achievable and appropriate for the period of performance. Reviewers will also look for how you will build on your DFC foundation to enhance and expand your coalition's ability to address prescription drugs, opioids, and methamphetamine use. The community served section is worth 5 points. In this section, you will describe the community you plan to address under this award and how you will include that community and meet their needs. Reviewers will look for a clear description of the geographic area or population served. The work plan section is worth 20 points and focuses on your 12-month action plan for 2026 to 2027. Reviewers will evaluate whether your plan provides a comprehensive approach to address the local drug crisis and prevent youth misuse using the 7 strategies for community-level change. Your work plan should include SMART objectives that are specific, measurable, achievable, relevant, and time-bound. It should also address risk and protective factors and clearly show how activities are connected to your goals and intended outcomes. The Evaluation and Performance Measurement Plan section is worth 25 points. You will describe how you will fulfill the requirements in the Data Monitoring and Evaluation section of the program description. Reviewers will evaluate the extent to which the applicant provides, how the coalition will participate in the CARA National Cross-Site Evaluation and collect data on prescription drug misuse, how the coalition will monitor and evaluate the success of the goals and objectives of the work plan, how the coalition will share findings with all segments of the community, including a description of the data that will be produced using these NOFO funds. The organizational capacity section is also worth 25 points, and it focuses on your ability to manage the grant and implement the proposed work. Reviewers will evaluate the extent to which the applicant provides the capacity of the organization to manage programmatic and fiscal requirements of the grant, including the roles and responsibilities of key personnel and recruitment and retention of coalition members, especially youth. The roles and responsibilities of the community coalition and fiscal agent if applicable, including how the sector representatives will be involved in achieving the coalition's goals and how the coalition will collaborate with other organizations. Next is the budget narrative, which explains and justifies the costs you include in your budget. Your budget narrative should be itemized, and it should clearly explain how each cost supports the proposed activities described in your project narrative. Applicants must submit the budget narrative using the budget narrative attachment form in grants.gov. And if you are requesting indirect costs, include a copy of your current indirect cost rate agreement. Now we will move to the required attachments. All attachments should be uploaded together in a single Other Attachments form in grants.gov. The first attachment is a table of contents for your full submission. This table of contents should list every document included in your application package, and it should also include all headings and subheadings used in your project narrative. Another required attachment is one set of coalition meeting minutes from a meeting held between January 2025 and the application deadline. Your meeting minutes must include the meeting month, date, and year, demonstrate coalition membership involvement, and include a list of attendees with the sector each attendee represents. Please note that the meeting minutes must be the coalition's minutes and not those of an outside organization applying on your behalf. This form, the General Applicant Information Form, provides critical contact and demographic information about your coalition and the community you serve. You must provide responses for all requested fields, including key personnel, your coalition's mission statement, substances addressed, the date the coalition was established, zip code served, and other community details. Next is the statement of legal eligibility, which is required to demonstrate that you are able to receive federal funds. If you, the coalition, are applying on your own behalf, you must have obtained 501c3 status before you submit your application, and you will sign and date the form. If you are partnering with an eligible legal entity to serve as your fiscal agent, that entity must sign and date the form. You must also include a statement describing the current rates of misuse of opioids or methamphetamines within your target community or population. You must provide the local data included in that statement describing the current rates of misuse of opioids and methamphetamines within the target community or population. The rates need to be higher than the national average. Provide the rates of use, the source of the data, and the year. For national rates of opioids or methamphetamine use, you can use Monitoring the Future or the National Survey on Drug Use and Health. For local data, this information should be based on the most recent and reliable data available and should clearly indicate the sources used. Please note, although the CARA statutory language states that applicants may demonstrate higher rates compared to the national average over a sustained period of time, there were methodological changes in the Monitoring the Future and the National Survey on Drug Use and Health surveys over the last 5 years. Therefore, applicants only need to demonstrate rates of abuse of opioids or methamphetamines at levels that are higher than the national average for 1 point in time. If you are using a fiscal agent to apply on behalf of the coalition, you must include a Memorandum of Understanding, or MOU. Your MOU should describe the relationship between the legal entity and the coalition, including each party's roles and responsibilities. A representative of the legal entity and a representative of the coalition must sign the document, and these must be 2 different people. Please note that an MOU may still be required if the coalition exists within the legal entity, or if the legal entity name does not match the coalition name listed on the SF 424. Another required attachment is the disclosure of prior DFC funding. You must indicate whether you have ever received DFC funding by completing the checklist and table included in the attachment. This slide includes 2 additional attachments that may apply to your application. First is the congressional notification, which provides a summary of your coalition and proposed activities. If your application is funded, this information may be shared with members of Congress and the media and may be posted publicly. Second is the indirect cost rate agreement, which is required only if you are including indirect costs in your budget using an approved rate. You must also attach resumes and job descriptions for key personnel. Include resumes for any key positions that are currently. For positions that are not yet filled, include a job description with qualifications and plans to hire. Please keep resumes to 2 pages each. Job descriptions should be no more than 1 page and should include the position title, a brief description of duties, and 1 to 2 sentences on your hiring timeline. If applicable, you must also submit a report on overlap if you have requested funding from another source in the same fiscal year and there is potential for programmatic, budgetary, or commitment overlap. Next, we will briefly review the other required forms that must be submitted as part of your application package. Applicants are required to submit several standard federal forms to supplement the application. These include the Application for Federal Assistance, or SF 424, the Budget Information for Non-Construction Programs, or SF 424A, and the Disclosure of Lobbying Activities, or SFLLL, if applicable. Be sure to name the file exactly as instructed in the NOFO. These forms are required, but they are not scored. This slide provides a few tips for submission. Use the application checklist to confirm that all required components are included, and pay close attention to who must sign each form and what must be submitted with the application package. Refer to the supporting materials document, which includes a glossary and also a checklist to ensure you have met the statutory eligibility requirements. Finally, make sure you are using the correct dates throughout your application materials. This slide summarizes the formatting requirements for key narrative sections. Be sure to follow the required font, file format, size, ink color, spacing, and margin guidelines described in the NOFO. Following these instructions helps ensure your application is compliant and can be reviewed as intended. Now we will briefly review how applications are reviewed and selected. Applications will first go through an initial review to confirm responsiveness, statutory eligibility requirements, and alignment with administration priorities. applications that pass initial review will proceed to merit review, where trained reviewers will assess and score applications based on the review criteria outlined in the NOFO. Prior to making an award, all applicants will also undergo a risk review to assess sound business practices. If your application is funded, there are important post-award requirements you must follow. These include CDC terms and conditions, HHS grants policy requirements, and applicable regulations and CARA statutory requirements. You must also comply with anti-discrimination laws and relevant executive orders as described in the NOFO. Post-award responsibilities include reporting, both financial and performance and programmatic, CDC monitoring activities, and required training. These are standard expectations and support accountability and programmatic success. Please note the application deadline and submit early, ideally at least 48 hours in advance, to avoid last-minute technical issues. Save or print your grants.gov confirmation and retain copies of all submitted materials. If you have additional questions about the CARA NOFO, please contact CARA_NOFO at cdc.gov. For grants management, fiscal, or budgetary questions, please contact DFC_OGS at cdc.gov or visit the webpage that is listed here.